Insurance is a big concern for all of us.
We'd like to give you an overview of the insurance plans available to you as OCPS employees and explain the differences in the plans.
We won't overload you with all the details here. You can find those in your insurance handbook.
The first thing to consider is which medical plan is right for you. There are 3 medical plans to choose from. 2 in-network plans, Plan A, Cigna Local Plus OAP in-network plan, and Plan C, Cigna OAP in-network plan, and 1 health reimbursement account, HRA, with an in-network and out-of-network benefit. Plan B, Cigna Health Reimbursement Account. Please see the rate sheet on the insurance website for biweekly and monthly deductions of all plans. In Plan A, the Cigna Local Plus OAP in-network plan, there are lower out-of-pocket costs, but you must choose doctors in the Local Plus network. This is a smaller network of doctors, and it is more restrictive than any of the other plans. There are no costs per pay period for full-time employees, but you pay a $250 individual or $500 family deductible before your benefits begin. Pharmacy costs may be higher in this plan.
In Plan B, the Cigna Health Reimbursement Account, you have lots of choices, but will probably have higher out-of-pocket costs. You can go to any doctor, but choosing doctors in the network will save you money. This plan has a $2,000 in-network, $3,000 out-of-network, employee-only deductible before co-insurance begins. The district funds $250 to be used for deductibles, co-pays, and co-insurance. Your in-network primary care physician and specialist visits are provided outside of your deductible. That is, you don't have to meet your deductible first. You simply pay your co-pay amount. Many services also require a 20% co-insurance.
In Plan C, the Cigna OAP in-network plan, there are lower out-of-pocket costs, but you must choose doctors in the network. You pay a small amount each pay period, and there is a $100 individual or $200 family deductible. Your in-network primary care physician and specialist visits are provided outside of your deductible. That is, you don't have to meet your deductible first. You simply pay your copay amount.
For all plans, routine preventive care, including preventive screening, is covered at 100%.
All 3 Cigna plans include an in-network hearing aid benefit. This benefit requires the use of a specific network, and there are quantity and cost limitations. In addition, deductibles, coinsurance, and copays will apply. For a full review, please refer to the medical section of the Insurance Benefits Handbook. It is recommended that you choose a primary care physician. Your PCP or personal physician is your source for routine care and guidance if you need to see a specialist or require hospitalization. In either Plan A or C, if you see a provider who is not in the Cigna Healthcare Network, your plan does not cover those services except in emergencies.
With all plans, you can choose doctors and hospitals in the Orlando Health Network and the Florida Hospital Network.
Visits to the emergency room are very expensive. Unless it's a life-threatening emergency, you're always better off seeing your own physician or going to an urgent care center for treatment. You'll spend less time waiting and it won't cost you as much. And here's some good advice. You'll want to choose a physician as soon as possible. New patients don't get in as quickly as established patients.
How much do I have to pay for medical coverage?
If you are a full-time employee, OCPS pays your single medical plan coverage. In Plan A, Cigna Local Plus OAP in-network. Plan B, Cigna Health Reimbursement Account, and Plan C, Cigna OAP in-network require that employees pay a small portion of their coverage. If you are a part-time employee working between 17.5 hours and 24.9 hours per week, you are responsible for part of the monthly cost. Refer to your rate sheet for the exact amount.
Another important OCPS benefit is for prescription drugs. Let's take a look. Prescription drug benefits differ between the plans, so checking out the differences between the plans is important if you use prescription medications. There are 3 co-payment tiers that all prescriptions fall into. You can check out insurance.ocps.net and select enrollment information to find out which drugs fall into which categories.
I've heard you can save money by getting prescriptions by mail. How does that work?
If you take medicine regularly, for diabetes or high blood pressure for instance, that's considered a maintenance drug. After the 3rd fill, maintenance drugs must be ordered by mail through CVS Caremark Mail Service Pharmacy, a CVS retail store, or for 90 days at a time from a participating retail pharmacy. By mail or CVS retail, you'll get a 3-month supply for the cost of 2 months.
My husband has medical insurance through his company for our whole family. Can I get something else paid for instead?
Absolutely. In that case, you can choose the Disability Vision Plan.
How long do I have to wait for the coverage to start?
From the day you start work, there is a 59-day waiting period. Your coverage begins the first day of the next month. Check the effective date sheet in your insurance materials to find the exact date.
I have diabetes. I know it's considered a pre-existing condition. How does it affect my coverage?
The Affordable Care Act has eliminated the pre-existing condition exclusion from medical plans. Your condition is covered as soon as your coverage starts.
Who else in my family is eligible to be covered under my medical insurance, and what does it cost?
Additional coverage for your spouse, same-sex domestic partner, and children are available options. Medical insurance costs the same for one child or many children. Eligibility requirements can be found in the insurance handbook available on the intranet. Please note, under IRS regulations, domestic partners and the children of domestic partners do not qualify as tax dependents. As a result, the premiums for any plans with a domestic partner or children of a domestic partner will be deducted post-tax, and the medical premiums made by OCPS on behalf of dependents will be treated as taxable income. Examples of the impact of this imputed income can be found on the Insurance Benefits intranet site. Employees should consult the tax advisor prior to adding coverage.
Now let's talk a little about optional plans you may want to add to your coverage.
OCPS pays for life insurance equal to your year's salary with a minimum of $7,500. There are 2 additional life insurance plans available to you and your dependents.
The first plan, the Dependent Term Life Insurance Program, covers all eligible dependents, both spouse and children.
The Group Universal Life Insurance Plan is also offered. You can continue this plan even if you leave OCPS.
What exactly is disability insurance?
Disability insurance provides some income if you are disabled and unable to work. Coverage is available from Lincoln Financial up to 66 2/3% of your salary, and with different waiting periods. New employees can sign up now without answering health questions.
You can purchase one of 3 dental plans for yourself and your dependents. 2 are managed care, HMO type plans, and 1 is an indemnity PPO plan. You can access the dental rates on the rate sheet available on the OCPS insurance website. Delta Care Basic is designed for preventive care. However, it provides some coverage for more extensive procedures. You must use a participating general dentist to receive benefits. Delta Care Comprehensive offers expanded benefits for specialty referrals made by your participating general dentist. This is the only plan that offers orthodontic coverage. The Delta Dental PPO plan gives you the freedom to select any dentist, but costs a little bit more. Choosing a dentist from the dental plan list gives you greater coverage and lower out-of-pocket costs. Employees and dependents are eligible for a 25% courtesy discount on orthodontics with participating orthodontists. There is no monthly premium, and it's not necessary to complete any enrollment forms.
OCPS offers a vision care plan to help you pay for eye exams, lenses, and glasses. It's available to eligible dependents as well. Benefits are offered through participating doctors. You can also receive services from a non-network doctor and be reimbursed according to plan allowances. There's also a courtesy vision discount up to 35% at participating eye med providers for you and your dependents, offered through Delta Dental with no enrollment forms or premiums. This discount doesn't replace the vision care plan, and you don't have to be enrolled in any Delta Dental plan to access benefits.
Can I get dental or vision coverage for my dependents, even if I don't carry them on my medical coverage?
As long as they meet the requirements as a dependent according to each plan, you can add your spouse, same-sex domestic partner, and children to any of the optional plans available. Domestic partners and their children are eligible for medical, pharmacy, dental, vision, group universal life, and dependent life insurance. Domestic partners and their children are not eligible to participate in the employee's flexible spending accounts or continuation of coverage through COBRA. If you typically spend a lot of money each year on healthcare expenses or daycare for your children, you may want to consider a flexible spending account.
FSAs allow you to set money aside through payroll deductions on a pre-tax basis, which lowers your taxable income.
There are two types of FSAs. One is for healthcare expenses and is called a medical flexible spending account.
The other is for dependent care expenses and is called a dependent care flexible spending account. The accounts are treated separately. You may participate in either or both accounts, but you can't transfer funds between accounts.
There are a couple of tricky things about FSAs. When you enroll, you designate how much you want to put into your account for that plan year. The plans are use it or lose it. So if you haven't used all of the money in your FSA by the end of the plan year, you cannot carry over that money to the next year.
Additionally, it's important to remember that if you want to continue your flexible spending account, it's not automatic. You must re-enroll each plan year.
Make your decisions carefully. Once you sign up for the plans you choose, you are locked in until the next enrollment takes effect in October. You can change doctors, but not plans.
These decisions are important, and here are a few things to keep in mind.
You may not put yourself down as your life insurance beneficiary. King Tut was the last person to pull that one off in style.
We know you're proud of your family, but only list your eligible dependents if you're enrolling in any family coverages. The Insurance Benefits website and the Benefits Bulletin are great ways to get the most up-to-date information about new or changing benefits.
The handbook can be found on the OCPS intranet site, along with other important information about your benefits.
Let's review how to find insurance information on our website. Once you have your email account set up, visit our site at www.ocps.net. Then go to the Employees tab and select Intranet. Sign in using your employee number and password and choose the Insurance Benefits link. Or you can go directly to insurance.ocps.net from your worksite computer.
Once you've watched this video, checked out the insurance handbook on the web, read over the FAQs, and reviewed the cost of the plans, you're ready to make your insurance selections. You have 2 weeks from your first day of employment to complete your insurance benefits enrollment. Otherwise, we can't guarantee that you'll get the coverage you want. Let's take a look at the enrollment process.
Go to our website at www.ocps.net and select the Employees tab. Sign in using your employee number and password, then select My OCPS/iBuy. Log in using your employee number and password. Select Employee Self-Service. Just a reminder, My OCPS cannot be accessed until the setup of your email account is complete. Once you're there, select the Benefits icon. Use the key documents and training guides for new hire enrollment to complete your enrollment. Remember, you have 2 weeks from your first day of employment to complete the enrollment process online. My OCPS cannot be accessed until setup of your email account is complete.
This is a big deal, and we want to be sure you get the insurance you need.
If you need any help, please call the Insurance Benefits Office at 407-317-3245.